At your first visit to the antenatal clinic in the community, you'll see your community midwife. She'll give you a lot of information and a lot of documentation. The first thing will be your pregnancy notes. These you'll carry around with you all the time, because if you have to leave the area, go to a different hospital, they'll want to see them.
Please follow the pink signs for Women's Services Outpatients to find our antenatal clinic where you are seen following your first assessment by your community midwife. You may attend the antenatal clinic for a scan, screening, or for any ongoing concerns or monitoring required relating to your health or your pregnancy. When your midwife first sees you in your pregnancy, she'll perform an assessment of your health and pregnancy history, and this will assist her to plan your pregnancy care with you. With a good pregnancy history and an uneventful current pregnancy, you will receive midwifery-led care. Lots of information leaflets and books are issued to you during your antenatal and postnatal period. This will support the information you are given by the health professionals. Midwives and medical staff will be able to give you advice around diet and nutrition, mental health, drug and alcohol use, the options available for mums who are teenagers, advice about weight management, and advice about giving up smoking. We also give financial advice and other support that can be found through organisations like Connections.
On the gynaecology ward, we do have an early pregnancy assessment unit. The staff nurse running that unit is very competent, she's very caring, she's always willing to help should you have any problems in early pregnancy. We're a very welcoming and warm team. Should you need our help, we're there for you.
Women with any risk factors will be cared for by a team of professionals and will be consultant-led. It is important to remember that women can change between care pathways as pregnancy progresses. Several screening tests are available in the first part of your pregnancy. Your community midwife will be able to give you more information about these tests. Here in the antenatal clinic is where your ultrasound scan will take place.
Throughout a normal pregnancy, a lady may expect to have at least 2 scans offered to her. The first scan is usually offered at about 13 weeks gestation, and that's predominantly to date the baby and to decide an expected date of delivery, which is a really important day. The second scan is usually performed at about 20 weeks and is a more detailed scan. And throughout both scans, the scans normally take about 20 minutes. Over the course of a pregnancy, a decision may be taken to do additional scans, and that depends on a number of factors decided by the obstetrician. And predominantly, if you are having a twin pregnancy, your scan time will likely to be double. You could expect a longer scan time so that we can assess both babies fully.
Reflexology clinics are provided to help women who have gone overdue. This service has been recognised for a Good Practice Award by the Royal College of Midwives. The service aims to start labour off naturally. We have a fantastic new hospital with new and exciting services that we can offer you while you're pregnant, during your labour and after you've had your baby. We have a team of highly skilled, kind and professional people who really want to look after you and make your stay with us enjoyable. There is a supervisor of midwives available 7 days a week, 365 days a year. The Supervisors of Midwives office is based in the antenatal clinic. Their role is very important to you as mums and dads and the midwives here, as they ensure that all the midwives are practising safely and protect you and your baby.
Within Walsall, we have a 24-hour on-call service so that women have access to a supervisor of midwives at all times. Our role is to ensure that the women have the service they want and that if there's any problems they can access it at all times. We're here also to ensure that the midwives keep up their skills and their abilities, so they offer a good quality service.
To make your hospital stay as comfortable as possible, your midwife will brief you on what items you need to bring into hospital. Just bring enough clothes for you and your baby for 24 hours, some nappies and any other items your midwife advises that you will need. If you think you're in labour or you have any concerns about the onset of labour, you should give us a call on our direct number 01922 656283 before leaving the house. There is easy access to the delivery suite using these double doors. This is the quickest way to come in or when you have appointments or are in labour.
Staff on the maternity unit understand that it's okay for families and prospective mothers to challenge them about hand washing, so that families and prospective mothers can see that staff are washing their hands within sight of them or using the alcohol gels. We would of course also encourage all visitors when they are visiting prospective mothers and when they come to visit new babies, that they too use the gels when they come to visit the ward areas.
To prevent cross-infection, it is paramount that whoever enters the delivery suite uses the hand gel provided before entering. Please ask your relatives to do the same on entry and when leaving all ward areas. You must always press the button by the hand gel dispenser before entering delivery suite and wait for a clerk or midwife to answer. The staff will give access to you and your relatives once they have had the opportunity to check who it is via the closed circuit TV monitor, and then let you in.